Please note that this podcast does not substitute for medical advice. This episode is sponsored by Biome Renew.
Welcome to another episode of the Microbiome Revolution. Excited to bring a new conversation along for us to have today. Once again, have Dr. Ashley Naidu a part of the panel. Great to have you again, Ash.
Good to be here.
We have two incredible doctors joining us today. Dr. Taheera, who is a specialist obstetrician and gynecologist in private practice at Medcare, Sunninghill, with a specialist interest in gynae aesthetics. Welcome, Taheera. And we also have joining us from Cape Town, Dr. Thulja, who is a pediatrician and allergologist in the public and private sector. Thulja, fantastic to have you join us over video. Thank you for making time for this discussion today. Before getting into it, of course, we've heard your fantastic medical backgrounds itself. Taheera, can you tell us something about you that we might not know?
So I'm a car fanatic. I enjoy racing on the racetrack in Kyalami.
Amazing. Car enthusiast, speed. What is it for you? Adrenaline, speed?
Need for speed.
Need for speed. That's amazing. Fantastic. Thulja, how about you? Anything from your side? Do you like jumping out of planes or bungee or anything like that?
Definitely not jumping out of planes, but something very relevant to the topic we're going to be discussing.
Yes.
I actually want to escape medicine and live on a farm.
Wow.
And cows and horses.
Is medicine that tough?
That's my ultimate goal and something that I've been verbalizing to all my patients.
That's phenomenal.
Very soon I think you're going to see me with the farmer's hat.
So the next time we video call you, you might be on a horse in a farm. That's what it's going to look like.
Also, the idea is a farm with no internet access.
Just make sure you make wine.
Oh, that's so amazing. Ash, of course, just from knowing you as well a little bit, also a car enthusiast.
Oh, yeah.
So we might have to see a race between Taheera and yourself at some point.
Absolutely.
That would be interesting. Hey? Maybe we do a podcast in a car, just as you guys.
Around the track.
Why not?
That's interesting.
Around the track, that would be amazing. Well, since we're in Women's Month, we want to share insight into the maternal health and vaginal health, fertility, as well as childhood implications of the microbiome. Really keen to get into this conversation. But as we like doing, we like throwing around facts and interesting facts. So Ash, what can you tell us around some of the facts around the microbiome or vaginal microbiome?
Look, it's a very interesting field. A few things most people don't realize is everybody's all about having high amounts of bacteria in the gut and a diversity and so forth. But with the vaginal microbiome, it's a very different thing. We want to have a majority of these bacteria to be lactobacillus based, yogurt bacteria,
Sure.
And a lot of this is derived from the gut and it finds its way to the vagina itself, but it's there for good reason. And when you have a high amount of bacteria in the vagina itself, it lends itself to something that it comes up quite common in these podcasts is dysbiosis, which means an altercation in the structure or function of that microbiome.
Sure.
And look, there's a lot of implications we're going to get to with Taheera a bit later, but there is ramifications of this dysbiosis towards disease states, cancer, fertility itself, and then how this whole thing washes over to the unborn child and then pediatric health for the long term in terms of their immune status, their growth, obesity, quite a few things that come from this one moment in life.
Quite a big ripple effect.
Exactly. So for lack of a better thing, it's to say that whole body microbiome health is a goal of what we are trying to instill in our public by doing these podcasts. And the basis of having experts like Thulja and Taheera around is to shed light on the average South African and how disease states have been changing and expanding during our term as specialist clinicians in this country, and to look at how we can implement these changes of the microbiome in our country using personalized care and using routines and regimens in life to try and implement better health in disease prevention, health promotion space.
So it's that holistic approach, once again, to how we are approaching just our well-being, which is super, super important. Thulja, I'd like to bring you in at this point, and we touched on this in previous podcasts as well, just around the importance of the first 1,000 days in a child's life. So I'd love for you, from your perspective and expertise, just thinking around, yourself as a practitioner, discovering the microbiome, and looking at the first 1,000 days of a child's life, just the importance in being conscious of that, and just, your point of view around this conversation.
Yeah, so the 1,000 days has been long proven to be a very important foundation for children as they're growing, but has ramifications, like Ashley said, far into adulthood as well. We all know that we're living in a world that's constantly changing, and one of our biggest examples of the fact that we have to adapt to change is that we had a pandemic 3 years ago.
Sure.
That the world suddenly had to deal with. Now, that is a big example of what happens when you have constant changes in your environment. And with a baby, you're dealing with constant changes in the environment, but you're dealing with changes in the environment while you're dealing with changes within yourself and in your body.
Wow.
So, I think that is really, really, really key factor with babies is in those 1,000 days, because there's so much of growth and development that's taking place. Literally every single organ of your body, be it your eyes, and more importantly, your immune system, which obviously has a massive role in the microbiome. What you're exposed to from the outside and what you put into your body really does have a massive role as you're growing in that time to then shape health, or as Ashley said, dysbiosis, which would then lead to disease. Essentially, what we want in that 1,000 days, because it's already been proven that it's really important at that time to be exposed to the correct things so that your body can deal with them later. So what you essentially want is to build up your immunity in a very, very strong way so that no matter what happens going forward, your body is then going to be able to, in a robust way, deal with it, but also keep changing with the changing times.
Sure.
So for example, if you're going to get another pandemic 25 years from now, we don't know if we're going to be around. But 3-month-old,
more than likely, yes.
But now,
yes,
is likely going to be dealing with that, and that's basically, in a nutshell, the concept of what we're trying to inculcate into healthcare practitioners, but also into the general public.
That's so good, because essentially what we're saying is, and what we're thinking along the lines of, is how are we setting ourselves up for success from a health perspective right from the get-go, and why this is such an important conversation for us to have. I think the more aware we are, because even with being a part of the conversations from previous podcasts and chats that we're having, getting to understand this myself, not from a medical background, I am starting to see the importance of us looking at every aspect of our internal and external exposure to give ourselves the best chance of surviving both in the now and for things that we haven't experienced yet. Like you said, something like a pandemic comes about. How are we geared to survive something like that as a human being? That's phenomenal. Taheera, just looking at yourself as well, and probably directing this question to you in a similar way, with you becoming aware of the microbiome as a practitioner, how is it changing your practice?
So, we have been aware that the microbiome existed in the 1800s.
Sure.
But now we find that, as Thulja said, it does reshape the way you practice, and in the sense of guiding your patients with regards to their vaginal microbiome. So in the sense, what the research studies have shown us is that if there's any dysbiosis in the vaginal microbiome, it can lead to lots of other gynae diseases. A simple example is endometriosis. Endometriosis is an inflammatory disease. And if you have dysbiosis, it actually makes your endometriosis worse. And, with the dysbiosis that presents in that area, women end up with candida, they end up with bacterial vaginosis, pelvic inflammatory disease.
Wow.
And all of these things contribute to pathological factors in that woman. And as a result of that, it also affects their fertility. The latest studies have also shown that when there is a dysbiosis, there's a very high chance of implantation failure in, things like IVF.
Wow.
So, if we pick these things up and we target our treatment, we can actually prevent fertility failure. And I think what the public needs to know is that we are aiming to target our treatment and personalize it per patient, because it's not always the best thing to just give a patient antibiotics or anti-thrush medication, because we might actually cause more harm. So targeted treatment is absolutely important, and I think that's why we want to educate our public that the microbiome, whether it's in the GIT, whether it's in your vagina, all of that needs to be reviewed. And I think we also need to be aware that it is present and that, there are different ways of managing dysbiosis.
Brilliant. That's so interesting. And I suppose it's almost that personal approach, the personalized element of like, listen, it's not a one size fits all. Let's look at what your challenges are, and let's look at what we could do for you and what you could do for yourself in terms of looking at what you are facing, engaging with, so that we could actually find a solution that is right for you.
And it's not one treatment fits all.
That's so good.
And that's what the primary goal of this podcast is.
Yes. And are you finding that just being more aware, like you said, doctors have been aware of the microbiome for a very long time, but now I suppose in figuring out and finding ways of how you could positively influence the microbiome of an individual, looking at treatments and ways that you could do that is actually showing to have a positive effect in ways that you might not have been aware of before.
Yes, absolutely. And, also, like Thulja said, your first 1,000 days is so important. And in my practice, if I start encouraging women to change their diets and to be, promote microbiome diversity, that little fetus that is born will have a better chance of having a much better, healthy symbiosis than dysbiosis.
Wow,
and
so
also,
good.
it also reshapes the entire medical sort of their medical implications with regards to chronic diseases such as diabetes, their chances of allergies, chances of cancers and Parkinson's. This all has been coming out in the latest research.
Yes.
And I think this is fabulous. I think everyone needs to know about the importance of the microbiome.
That's amazing. And Thulja, just to direct some of that question towards you as well, in regards to changes around your practice, things that you've become more aware of and now implementing as well, and talking to your patients about. Can you bring us just into the light of some of those things?
Yeah, so like Taheera said, we talk about the first 1,000 days, and often as a pediatrician, we look at babies from day zero of life. But so much of research has now proven, because my specialty is allergy and immunology, that the microbiome even shapes your risk for diseases such as allergies and infections as well. So one of the first things I say to a lot of my patients, and this is to the moms, if you know that there is a risk of allergies in your family, if you know that you are not allergic to anything, ensure that you're getting all of the things into your diet. Play with the dogs and the cats. Go out and get yourself exposed to everything, because from the time you're pregnant, literally from the first and second trimester, your baby through that placenta is being exposed to bits and pieces of the bacteria, the viruses, the fungi. So those are all the bugs. But also from my side as an allergologist, the proteins from things like peanuts, cow's milk, wheat and things like that. And the changes come in because in the past, a lot of people believed that when you were pregnant, you actually had to be afraid of these things and stay away from them. You needed to be careful. So not only is this information that helps reduce allergies, but it's stuff that, if you're going to avoid it, if we're not going to keep up with the changing times, research has proven in the field of allergy and immunology that your child is now more likely to react.
Wow.
It goes back to what we spoke about before, is your immune system is basically a shapeable tool. And if you're going to keep your immune system naive, your immune system is going to then be more likely to be sensitive or more likely to react. But if you're going to get your immune system exposed literally from the womb, and your immune system is going to then build up its own immunity, it's going to be more likely to be tolerant and more likely to be immune and strong. And that's essentially what we want.
That's so incredible. So it's almost a shift in society in terms of how we are looking at exposure and non-exposure. So everything we thought, well, I won't say everything because that's a broad statement, but a lot of things that we assumed and thought, and maybe were even advised to in the past to be non-exposed to at certain periods, we actually need to reconsider that and relook at that, because we want to strengthen and shape and build, like you mentioned, our immune system to be able to take on many things. And even just thinking about allergies, just as a non-medical professional, just looking at society and being aware of how many more allergies there seems to be across the board from maybe 20 or 30 years ago that we either weren't aware of, or has just become a wider topic of conversation. And what we are saying is we can actually influence that by choosing what we are exposing ourselves to on exiting the womb.
Yeah. And it's actually
absolutely.
it's before
and
that
that's
as well.
why the importance that's where the importance of the exposure comes through, because firstly, we're dealing with an allergy epidemic. That's been proven. And often parents say to me, but when we were younger, we never heard this much about allergies. So, your child already in risk when we were baby. So, as the time is changing, if we're not addressing, well, firstly, why are things changing? Why are we having diseases that are taking lives like coronavirus, COVID-19? Why are microorganisms and bugs of our admitted patients? And that's where
So it is really interesting, and I love the fact that you used, like the terminology of actually having, I suppose, a society that is having many more allergic reactions. I think you used the word epidemic, an allergy epidemic. So it's not just in our minds. No. It's not something that we think, hey, we're just hearing about this. It is an actual fact that this is happening. And so this conversation is super important across the board in so many ways.
Often the example I use, right? We know about the era of dinosaurs.
Yes.
And if change in their natural environment, there's a chance, like many other animals and many other stages in evolution, that they would not have gone extinct, and that's been proven. So it's literally, we're living on planet Earth. Earth is changing, but also to adapt to our changing environment, because that adaptation is really important, not just for prevention of disease, and for survival, period.
Yeah, that's so good. I think that word adapt is something we've heard so much, especially over the last three and a bit years, thinking about what we've experienced as society. But it is one that we have to be conscious of.
Exactly.
How are we adapting? How are we looking at our environment? How are we being intentional with what we are doing to shape our health, essentially? Asha, I'm not sure if you want to add anything into that.
So I think this thing about ecology of the microbiome, this is a nice way of looking at it, right?
Yes.
I mean, you go out to a game park somewhere and you want to see a diverse amount of different animals, diverse plants, so forth. Everything looks happiness in that scenario. Why aren't we looking at ourselves with a microscope in the same way,
That's such a good point.
Each one of these things were placed on us for a specific reason. We named Propionibacterium acnes to Cutibacterium acnes, and we think he's the bad guy and everything. But it's emerging now that subspecies and strains are responsible for good actions in the skin at the same time. So they're not all bad. So we've got to really dig into different areas of the microbiome for this. Now, the one thing I'm going to add is we're talking about Women's Month and women's health issues and crossover to children. And I'm sure Taheera is going to back me on this one. Is man's role in all of this is not being spoken about here, right? But I'm gonna crack something wide open here. There's such a thing as the penile microbiome, just so you know, right? And in uncircumcised males, that have partners that they with for at least a year, they share a very similar microbiome in their foreskin to the vagina itself. So if you find somebody with recurrent infections, if you find somebody with transmissibility of HIV, of STDs, of all of these things. It's not a women's health issue. It's both sides of that coin. And I think we need to be addressing these kind of things, because if you're looking at infertility, it's a blame game quite often in quite a few households, right? But what if this is a result of a microbiome issue on the other side that's transmitting across as easy as the microbiome can to cause
a lot of likes coming dysbiosis?
No, but I mean, look,
it's a good point.
You've got to have an open mind to what's happening here. So this is why we're saying that everyone in that household is going to shape the pregnancy process. Everyone in that household is going to shape the child's immunity, including your dog.
So it's like a household approach.
It's a household approach.
Wow, that's so incredible.
And another thing that's quite big is obviously, look, the expanded immunization programs and so forth are looking at things like human papillomavirus, right? We're all for the idea of preventative healthcare, but if we take this a few steps backward and start to look at the roles of human papillomavirus with cervical cancer, it's the fourth commonest female cancer now. It's growing in its numbers, and the reality is a high amount of our population is going to face this problem because of recurrent vaginal tract infections and recurrent states of dysbiosis. And an important thing that's coming out from microbiome research around the world is specific good bacteria are missing while some bacteria are proliferating in that vaginal microbiome that are present in patients that are unable to get rid of that HPV infection. Now, if you have HPV in infection that lasts longer than 2 years, your risk incrementally goes up of cervical cancer for the long term. So rather than waiting for the 2-year mark or addressing this at some point, like if we all knew how to deal with vaginal dysbiosis from an early state, you create a favorable environment to use your body's own elements to be able to keep those kind of things at bay. You might actually make a significant dent on a very important
That's
cancer.
so incredible, because the more you speak about it, I can see the shift happening from starts with the person, like you're looking at yourself, then you're also looking at your household. And if all of those things align as a society, then there's a societal a factor with how we are actually being healthier as
it's all of
as
us.
a world. Right?
It's all of us.
Like that's what it is. And Thulja, just even thinking about you using the examples around the dinosaurs and so on, that's essentially what we're saying is, hey, as a world, we need to rethink, relook, initiate and activate how we are approaching practices around taking care of our health.
And it's a cultural thing as well.
Yes.
Like Taheera is going to tell us a bit about this as well. But I'm going to raise one point on the skin because I'm there most of the time. But with our Muslim communities, there's recent studies that have come out of the Middle East that are showing that shift is happening in the types of materials that hijabs are being made with.
Wow.
And the reality is obviously the links towards flare-ups of skin diseases because of changes in the microbiome under it, right?
Wow.
And I think it's important that that these things are addressed, because you need to adjust the textiles. You need to be able to support everybody's cultural differences and everybody's cultural ones.
Yes.
And in the same way, practices, I think, for personal hygiene, I think is an important one for Taheera to educate us about, but it has implications for how we deal with our own ecology of our own microbiomes.
Absolutely. Taheera, is there anything you want to add to that?
Ashley and I were discussing a little earlier, simple, female hygiene practices that are seen in different cultures, especially the Muslim culture. In our culture, we're told that we have to wash in a certain way. And as a result of that, you end up washing away all your normal, healthy vaginal microbiome. And as a result of that, these women end up with recurrent infections. And then there's a cascade of all events, recurrent infections, the yeast that presents itself, bacterial vaginosis, then eventually pelvic inflammatory disease. And like I said earlier, it also contributes to infertility because now you get your peri-implantation failure. And I think by bringing this up, we also need to educate all those around us, not just the Muslim community, even others that are using personal hygiene products to wash at the bottom.
Yes.
There's also practices in other cultures where they're told that, the vaginas has to be scrubbed clean. And, you're not supposed to have discharge. You're not supposed to have anything on it. It must be completely dry. And that completely disrupts it causes dysbiosis. And and that leads to all of these cascade of events, and you're basically shaping yourself for pathology instead of having a healthy vagina.
That's incredible. So the more I listen to this, what it sounds like to me is like we almost have to not just re-engage in our conversations, but almost rethink our
Daily practices.
Our daily practices and what is clean. And I say that in inverted commas, is that healthy?
No, that's the key. That's the
link,
key thing.
like
So with the entire dysbiosis
Yes.
state, what we're finding is the words clean hypothesis.
Yes.
The clean hypothesis is the more times you're showering in the day with more different types of soaps, and it comes back to something I said in the first podcast. When's the last time you read the back of your shower gel? You don't know what you've exposed yourself over your lifetime to, and the reality is that clean story isn't what we thought it was. Nothing is at all sterile. I mean, coming back as a surgeon, you're a surgeon as well. We'll bring this back in. Healthier wounds that heal with better scars have more bacteria.
Wow.
Said it.
Wow. This is incredible because, of course, we can understand the marketing behind all of these, products that we might use and how subliminally over time, and then obviously just through conversation and practices and how we operate as society, we have come up with what is clean and healthy for our bodies through all of these different elements. And I'm saying that once again as a large, broad statement, but it's time that we have a conversation around this and maybe break the narrative and maybe even the stigma across certain ways of operating and treating ourselves so that we are actually in a healthier state rather than an inverted comma clean state as human beings. Thulja, anything you want to add from your side in regards to that?
The impact of the microbiome from the allergy perspective. As you mentioned that, you hear about everyone having allergies these days. It's a joke I often pass very candidly that when I'm in a mall or in a restaurant, I literally feel like Oprah Winfrey because I can see from people's faces and their eyes, I'm like, that person has allergy, that person has allergy, literally. Because really, it really is that prevalent now. Often, a family would come to me and I'm seeing the child and the father and the aunt have made appointments because when listening to me, they realize, hold on, we also have those symptoms.
We got to check ourselves,
just to speak. And so allergy is a new field in South Africa in terms of an actual specialty. So it wasn't really very well understood and well researched in South Africa previously. But one country where allergies have been properly researched and the field has a, whenever we read these things in the news, always about peanut allergy and often accidents that lead to, unfortunately, sometimes death in children that, make headlines. It's often something in the United States, where a child has eaten a peanut butter sandwich by accident at a restaurant, lots of litigation around these things. But, bearing in mind that United States has been showing that allergies become a problem in developed countries, first world countries. There was a study among the Amish population. And the Amish population living under the same sky on the same earth as the rest of the USA, your California, your New York cities, and your very urban lifestyles showed zero allergies.
Wow.
So the same time that the United States was literally increasing in allergies, you've got a population of humans who natural proof that to your microbiome.
That is incredible. Like you can be in the same country with different practices in a different environment and experience, sort of different complications that come alongside what you're exposed to, essentially. Once again, just talking about it on a broad scale. I want to move on to a different question, just considering your understanding, your exposure, how things are changing in your practices. But Taheera, I'll pose this to you firstly. In your personal life, have you made any changes specifically in the recent history just regarding supporting a healthy microbiome in your own life, in your own body?
Absolutely. With all the research that has come out, I've changed my diet, to reduce our stress. Also with the practice of washing at the bottom, even though I'm a gynecologist and you have to follow, what you tell your patients,
Sure.
as well as your religious side of things. So I have adapted in a different way so that I protect my microbiome, so that there's no dysbiosis, and at the same time also educating all those around me and bringing awareness about the microbiome. And yeah, that's how I've changed things with myself.
That's amazing. Literally practicing what
we preach.
It's-
Absolutely.
And we know there's nothing more powerful than personal experience as well. So if we're living out something, if we engaging in a certain practice, and even with the medical knowledge, seeing the knowledge of that playing out in our life, that's more powerful, especially when you're dealing with your patients and having those conversations.
you can't have you can't dictate to your patients when you don't practice what you're dictating to them.
Absolutely.
So it's
you had to
leading by
say-
example, basically.
which is the best way, right? It's the best way to demonstrate the power of something. If someone's listening right now and going, wow, that sounds like a lot like me, how I'm practicing, how I'm approaching things, what would you say is the best starting point if we want to relook at how we are kind of engaging in daily practices and so on? If we want to have a healthy microbiome, what would you say is the best starting point in your expert opinion?
So start with your diet first.
Brilliant.
Absolutely, your diet. Reshape what you're putting into your mouth. Reduce your sugars, reduce your carbs. Be careful of antibiotics as well. Every time we have an infection, the first thing we want to do is pop an antibiotic into our mouths. Simple things like yoga, mindfulness, all of those things play an absolute role in creating a healthy, diverse microbiome.
That's incredible. Ash, from your side, if you had to hey, one thing, if you could focus
I'm going to bring it to Ikigai.
The Japanese concept.
The Japanese philosophy. It's something that I've tried to model into my life of recent. And it's more like the intersection of finding something that keeps you busy, but finding something that's going to make a difference to the world that's needed, and has a space to try and help us in trying to live longer and a more meaningful, fruitful life, right? The Japanese cultures has shown us that in Okinawa, it's one of the blue territories as such, where you find people living well into the centenarian age groups. And the reason for it is not that they are chasing up high amounts of points in the gym, but it's about having that balance between vegetarian diets together with some fish, having I'd say a mild to moderate amount of exercise, and to have meaningful relationships with people, right? So it's also that socializing has a way of influencing your microbiome too.
Wow.
Right? And this is
that's interesting. Socializing has a way of influencing
it
your
does.
microbiome.
So in a clean status here, like if you live in an environment where you have flatmates, just so you know, it takes a few months before you start to share the same microbiomes. So injury to one, injury to all, and that's it. It's that, like as a community, it's going to be shaped over time. And this is why man is evolving when our microbiomes are evolving. And this is the way we have to see it, right? So if you're wondering why there's more non-communicable diseases, because we practice things a lot different to what life was 50 years ago, right? Certain bacteria that we had in our gut 50 years ago, we don't find now. And I'm going to give you some interesting ones here, right? There's some bacteria that have been found in cheese that keep French people slender. Like here's a fascinating thing. Right?
I need to know that bacteria.
Yes, please.
I need that bacteria.
Is it just for French people?
From conversing with quite a few experts in the microbiome field from around the world, these are things that come up, everybody thought it was smoking, but not quite, not really. Right? So there are bacteria that you'd find in certain populations that we're not finding in our population. Wow. Some that you find in their youth that you don't find in our youth. And that's why we're all different shapes and sizes and disease states and all of these things.
That's amazing. I think when we look at communities, societies, maybe with an external eye, and we're trying to piece what makes this one different from the other, you can actually tie it down in some areas to what are they exposed to,
and their practices.
Their practices.
Yeah. Look at the Asian populations, right? So it's a well-known thing that Korean skincare and Asian people in Asia themselves practicing traditional forms of skincare have almost flawless skin. Wow. Right? Yeah, this is a reality, right?
That is true.
But a simple thing like using rice water to wash your face. This is a practice, Fermented rice water is a practice of stabilizing your microbiome. There were no scientists back then. These were people that did it from experience to their culture and religion that found the
that is
center
true.
point,
Yeah.
So bringing this back, a lot of this microbiome science actually is not new. It's just forgotten.
Yes.
And I think the reality is modern medicine has shaped us in a certain way as practitioners to practice in a certain way. And sometimes it's tainted by the pharma industry, sometimes it's tainted by the surgical industry, or sometimes it's just us being scientists and we skip over something that has relevance to large populations. But we must not separate religion, culture, and science.
Wow.
I think those three things have to be an intersection for us to survive a meaningful life in the future.
So what we're actually saying is the microbiome, and I know we've mentioned it in different ways, it's not a new science.
No.
It's not something new at all. You pointed out doctors have been aware of it from the 1800s. Already, Ash, as you pointed out, ancient cultures have been using this time and time again, maybe not understanding what it was, but it was a part of their daily routine, and that's carried through in cultural activities and practices, as we can see, and evidently so in some areas as well, as we've pointed out. And so it's us now almost being reawakened to the power of the microbiome, the influence of the microbiome, both in the positive and the negative, and how we can then channel and apply this in our lives. Just out of interest, Ikigai, Ikigai.
Yeah, worth a read.
Worth a read.
Every page.
I thought it was just a coffee shop on the Garden Route, because that's how I came across the name. There's a coffee shop on the Garden Route. There's a special shout out called Ikigai, really good. But it's a fantastic practice that I'm also becoming aware of. As we land this conversation, it's been phenomenal. I think I've listened to and found many other areas we can take the next conversations into. But the last question I'm going to pose is to each one of you. Your message to the public. If you had one thing or two things that you'd want to pose to the public or encourage the public with, just a simple message to the public. Taheera, starting with you, what would you want the public to be just aware of?
So creating awareness with the microbiome and reshaping your microbiome can change your entire health status in both the public and private sector.
Wow. So that literally looking at that can have transformative impact across the board.
Absolutely.
Essentially. That's amazing. Thulja, yourself, what would you like to say to people that are listening?
I think keep it simple. Literally. I think that basically, the discussion Ashley was having with you now is we're actually going back to something we already knew.
Yes.
And as much as we're advancing, and science and research is actually bringing out new techniques and new therapies that are very, very targeted now. Basically, what a lot of these therapies in a field that I deal with very often called precision medicine is actually really showing us a very exciting field. But what it's showing us with some of the drugs that are coming out now, which we call biologics, is every disease you have goes deeper at a cellular level, and every cell has a role to play with our risk or our benefit. And keeping things simple as possible is actually a good way to practice health. Like Taheera said, not rushing to antibiotics every time you get sick, and making sure that your body, and this is something that I always recommend to adults and children, is exposed. Exposure is key. Irrespective of your environment and where you live in the world, you want your body to be exposed to everything so that your body, as a robot or a fighting machine, is able to adapt and give you the best health possible.
That's so great. So keep it simple and expose yourself to different elements. And that's such great advice, because I think sometimes we tend to overcomplicate our approach to life, and with good old Google out there, people are used to Googling symptoms and all of this, and you get just an information overload, and you're like, oh my gosh, what do I do here? But just keeping it simple and exposing yourself to different environments can have an incredible ripple effect in yourself. Ash, what would you say?
Look, I'd like to bring it back to the whole personal care scenario. Sure. I think we need to start to question what exactly we are using on a daily basis. Although an antibiotic single dose has a big ramification for the microbiome, it is a dose-dependent thing over a period of time. But if you use the same soap your entire life, you have changed that microbiome for a much longer duration than a course of antibiotics. Sure. We don't want to spread the message that you shouldn't be using antibiotics. I think you have to be directed by your practitioner based on their expertise and based on what they're finding. But around your personal care on a daily basis, we very rarely go beyond the label, you know. And I think we need to start to question what it is that we are putting in us, on us, around us, and that discussion is something that's going to be taking this forward in the long term. You know, it's not just soap, it's not just a toothpaste, it's not just a mouthwash, you know? It's not just a Femi wash. And on the aesthetic side, like we use a lot of these products these days to address things like pigmentation and address a whole lot of other pertinent matters that people are dealing with. But you just have to be cognizant of what is it going to do to the microbiome in the long term. You know, what am I doing in this state? You know, maybe you treat one thing and find another thing, you know. I think it's important to be understanding that everything is a chemical. Food is a chemical. Look at it that way. And you might actually make some meaningful changes for the long term.
That's really good, because essentially what you're saying is everything has a place. You know, so seek the right advice, ask the right questions, and just be a bit more like cognizant of what we are engaging with, but from a health perspective, from a daily practice perspective, so that we're making wise and informed decisions that can have a lasting effect on the health of our body. I think that's a great place to land this conversation. Thulja, Taheera, Ash, it's been fantastic to have you guys on this conversation. Every time I leave this table, I feel like I could go practice medicine. I probably shouldn't, but like I just feel like so excited by what we are finding when we talk around the microbiome, and just the incredible impact this is going to have on us as a society if we embrace it correctly, and if we encourage other people to do the same. There's wide ranging ramifications in a positive way of how society can keep progressing. So thank you very much for listening. I'm sure you would have found something really insightful to take away, to go away and practice on your own. We've heard some great ways in terms of how we could start, what the starting points could be for us. In good time, we'd love to get your feedback on things that you've been practicing, that you've engaged with in your daily life and daily routine that's had positive impacts on yourself, your family setting, and society around you. That's it for this episode of Microbiome Revolution. It is a revolution. We're not using that word lightly, and we look forward to chatting with you and having further conversations in the not too distant future. Thank you.